In this video, we'll study about the histology of the cartilage. Cartilage is a tissue that forms the skeletal basis of some parts of the body. Example, the auricle of the ear, the lower part of the nose. So when you feel these parts, they readily demonstrate that this part is sufficiently firm to maintain its form, but it is not rigid like bone. It can be bent and returning to its original form when the bending force is removed. The cartilage is considered to be a specialized connective tissue. It resembles the ordinary connective tissue in that the cells in it are widely separated by a considerable amount of intercellular or extracellular matrix. This is also known as the ground substance, within which you have the fibers embedded. The cartilage differs from the typical connective tissue mainly in the nature of the ground substance. This is firm and gives cartilage its characteristic consistency. Three main types of cartilage can be studied depending upon the number and the variety of fibers in the matrix. So these are hyaline cartilage, the fibrocartilage and elastic cartilage. The free surfaces of hyaline and elastic cartilage are covered by a fibrous membrane that is called as the perichondrium, but the fibrocartilage is not covered by the perichondrium. Next we'll see about the general features of the cartilage. The cartilage is derived embryologically from the mesenchyme. Same mesenchymal cells differentiate into cartilage forming cells. They are known as the chondroblast. The chondroblast becomes imprisoned within the matrix and they become chondrocyte. Some mesenchymal cells that surround the developing cartilage form the perichondrium. Apart from the collagen fibers and the fibroblast, the perichondrium contains the cells that are capable of transforming themselves into cartilage cells when required. The cartilage has very limited ability for regeneration after destruction by injury or disease. The defects in the cartilage are usually filled in by the fibrous tissue. During fetal life, the cartilage is much more widely distributed than in adult. The greater part of the skeleton is cartilaginous in early fetal life. The ends of most long bones are cartilaginous at the time of birth and they are gradually replaced by bone. The replacement is completed only after the full growth of an individual. The replacement of cartilage by bone is called the ossification. The ossification of cartilage has to be carefully distinguished from calcification. In calcification, the matrix hardens because of the deposition of calcium salt, but the true bone is not formed. The cartilage is usually described as an avascular tissue. However, the presence of cartilage canals through which the blood vessels may enter the cartilage is well documented. Each canal contains a small artery surrounded by numerous venules and capillaries. The cartilage cells receive their nutrition by diffusion from the vessels present in the perichondrium or in the cartilage canals. The cartilage canals may also play a role in the ossification of cartilage by carrying the bone forming cells into it. So next we'll see about the growth of the cartilage. The newly formed cartilage grows by multiplication of the cells throughout its substance. This kind of growth is known as the interstitial growth. The interstitial growth is possible only as long as the matrix is sufficiently pliable to allow the movement of cells in it. As cartilage matures, the matrix hardens and the cartilage cells can no longer move widely apart. In other words, the interstitial growth is no longer possible. At this stage, when the cartilage cells divide, the daughter cells remain close together and they form the cell nest. Further growth of cartilage now takes place only by addition of new cartilage over the surface of the existing cartilage, and this kind of growth is known as the oppositional growth. It is possible because of the presence of cartilage forming cells in the deeper layers of the perichondrium. Next we'll see about the components of the cartilage. Like the other connective tissue, the cartilage is made up of cells. Here the cells are known as the chondrocytes. And then you have the ground substance. So this ground substance is also known as the intercellular matrix or the extracellular matrix. Then you have the fibers. The fibers mainly present here are the collagen fibers. So now we'll see about the cartilage cells. The cells of the cartilage are called chondrocytes. They lie in the spaces which are known as the lacunae present in the matrix. At first, the cells are small and they show the features of metabolically active cells, and the nucleus is euchromatic. Mitochondria, endoplasmic reticulum and Golgi complex are prominent. So these cells are known as the chondroblast. As the cartilage cells mature, they enlarge, often reaching a diameter of 40 micrometer or more. The nuclei here becomes heterochromatic and organelles becomes less prominent. The cytoplasm of the chondrocyte may also contain the glycogen and the lipids. Next we'll see about the ground substance. The ground substance of the cartilage is made up of the complex molecule containing the protein and the carbohydrate, which is known as the proteoglycans. The carbohydrates are chemically the glycosaminoglycans, and they include the chondroitin sulfate, the keratin sulfate and hyaluronic acid. The core protein is aggrecan. The proteoglycan molecules are tightly bound. Along with the water content, these molecules they form a firm gel that gives the cartilage its firm consistency. Next we'll see about the collagen fibers of the cartilage. The collagen fibers present in the cartilage are chemically distinct from those in other tissues. They are described as type 2 collagen. However, the fibrocollagen and the perichondrium, they contain the normal type 1 collagen. Now we'll study about the hyaline cartilage. The hyaline cartilage is so called because it is transparent. Its intercellular substance appears to be homogeneous, but using special techniques it can be shown that many collagen fibers are present in the matrix. The fibers are arranged so that they resist the tensional forces. The hyaline cartilage can be considered to a tire. The ground substance corresponds with the rubber of the tire, which resists the compressive forces, while the collagen fibers corresponds with the threads of the tire, which resist the tensional forces. In hematoxylin and eosin stain preparation, the matrix is stained blue, that is the basophilic. However, the matrix just under the perichondrium is acidophilic. Towards the center of the mass of the hyaline cartilage, the chondrocytes are large and they are usually present in group 2 or more. The groups are formed by the division of a single parent cells. The cells tend to remain together as the dense matrix prevents their separation. The groups of cartilage cells are called as the cell nest or isogenous cell groups. Towards the periphery of the cartilage, the cells are small and they are elongated in the direction parallel to the surface. Just under the perichondrium, the cells become indistinguishable from the fibroblast cells. Immediately around the lacunae housing the individual chondrocytes and around the cell nest, the matrix stains deeper than elsewhere, giving the appearance of capsule. So this deep staining matrix is newly formed and it is called as the territorial matrix or lacunar capsule. In contrast, the pale staining matrix separating the cell nest is called as the interstitial matrix. Calcification of hyaline cartilage is often seen in old people. The costal cartilage or the large cartilage of the larynx are commonly affected. In contrast to the hyaline cartilage, the elastic cartilage and the fibrocartilage do not undergo calcification. Although the articular cartilage is a variety of hyaline cartilage, it does not undergo calcification or ossification. When you see the pathological correlation, with advancing age, the collagen fibers of the hyaline cartilage becomes much more prominent, so that in some places the hyaline cartilage is converted to fibrocartilage. It has been said that the transformation of hyaline cartilage to fibrocartilage is one of the earliest signs of aging in the body. Next we'll see about the distribution of the hyaline cartilage. So first is the costal cartilages. So these are bars of hyaline cartilage that connect the ventral end of the ribs to the sternum and to the adjoining costal cartilages. They show the typical structure of hyaline cartilage described above, and the cellularity of the costal cartilages decreases with the age. The next example is the articular cartilage. The articular surfaces of most synovial joints are lined by the hyaline cartilage, and these articular cartilages provide the bone ends with smooth surfaces between which there is a very little friction. They also act as a shock absorber. The articular cartilages are not covered by the perichondrium. Their surface is kept moist by synovial fluid that also provides nutrition to them. The skeletal framework of the larynx is made up of number of cartilages. Of this, the thyroid cartilage, the cricoid cartilage and the arytenoid cartilages are composed of hyaline cartilage. And then the walls of the trachea and large bronchi contain incomplete rings of cartilages, and the small bronchi have pieces of cartilages of irregular shape in their wall. Parts of the nasal septum and the lateral wall of the nose are made up of pieces of hyaline cartilage. In growing children, the long bone consists of a bony diaphysis which corresponds to the shaft and one or more epiphysis which corresponds to the bone ends or projection. Each epiphysis is connected to the diaphysis by a plate of hyaline cartilage that is known as the epiphyseal plate. This plate is essential for bone growth. Next we'll study about the elastic cartilage. The elastic cartilage or yellow fibrocartilage is similar in many ways to the hyaline cartilage. The main difference between the hyaline cartilage and elastic cartilage is that instead of collagen fibers, the matrix contains numerous elastic fibers that forms the network. The fibers are difficult to see in hematoxylin and eosin stains section, but they can be clearly visualized if special method for staining elastic fibers are used. The surface of elastic cartilage is covered by the perichondrium. The elastic cartilage possesses greater flexibility than hyaline cartilage, and they readily recovers its shape after being deformed. When you see the distribution of the elastic cartilage, it forms the structural basis of the auricle or the pinna and the lateral part of the external aquistic meatus, then the wall of the medial part of the auditory tube, the epiglottis, and two small cartilages, the carniculate and the cuneiform cartilages. So these are made up of elastic cartilages. The apical part of the arytenoid cartilage is also the elastic cartilage, but the major portion of the arytenoid cartilage is hyaline. So here you have to see that all the sites mentioned above are concerned either with the production or reception of the sound. Next we'll see about the fibrocartilage. On superficial examination, this type of cartilage looks like the dense fibrous tissue. However, in this section it is seen to be cartilage because it contains the typical cartilage cells surrounded by capsules. The matrix are pervaded by numerous collagen bundles, among which there are some fibroblasts. The fibers merge with those of the surrounding connective tissue. There is no pericardium over the cartilage. This kind of cartilage has great tensile strength combined with considerable elasticity. The collagenous fibrocartilage is different from the hyaline cartilage is that the fibrocartilage has type 1 collagen fibers, whereas in the hyaline cartilage it is type 2 collagen fibers. The fibrocartilage, in contrast to hyaline cartilage, they does not undergo calcification. Next we'll see about the distribution of the fibrocartilage. The fibrocartilage is more prominent in the secondary cartilaginous joints or symphyses. These include the joints between the bodies of the vertebra and the pubic symphysis and manubriosternal joint. So intervertebral disc is also an example of the fibrocartilage. In some synovial joint, the joint cavity is partially or completely divided into two joint cavity by an articular disc. So these discs are made up of fibrocartilage. Example are the temporomandibular joint, the sternoclavicular joint and the menisci of the knee joint. Then the glenoidal labrum of the shoulder joint and the acetabulum labrum of the hip joint are also made up of fibrocartilage. In some situation where the tendons run in the deep grooves on the bone, the grooves are lined by the fibrocartilage. The fibrocartilage is often present when the tendons are inserted into the bone. Next we'll study about the pathological correlation. First we'll study about the cartilage forming or chondroblastic tumors. So in this first we'll study about the Osteocartilaginous Exostosis or Osteochondromas. So these are the commonest benign cartilage forming lesions. The exostosis arises from the metaphysis of the long bone as exophytic lesion. Most commonly it occurs in the lower femur and upper tibia and upper humerus. Next we'll see about the enchondroma. Enchondroma is a term used for the benign cartilage forming tumor that develops centrally within the interior of the affected bone, while the chondroma refers to the peripheral development of the lesion. Next we'll study about the chondroblastoma. It is a relatively rare benign tumor arising from the epiphysis of the long bone adjacent to the epiphyseal cartilage plate. Most commonly affected bones are the upper tibia, the lower femur and upper humerus. Next we'll study about the chondrosarcoma. The chondrosarcoma is a malignant tumor of chondroblast cells.